it's not as easy, but it's better longer term. And there's so many implications to our health. And it seems crazy that as a medical company, that companies are using a product that harms people's health when they're supposed to be helping them.
In this episode of Sustainable Healthcare, we venture into the role of entrepreneurs and their development of sustainable products and discuss how healthcare can approach eco-friendly innovations.
Welcome, listeners, to Sustainable Healthcare. I'm Tim Doak, and today we're talking about plastic in healthcare and what goes into the development of sustainable products in the healthcare field. Joining me today is Lara Solomon, the founder and CEO of Hoopsie, which is a company producing eco-friendly home pregnancy tests that are 99% plastic-free. Lara is an entrepreneur who can help us better understand the hoops she went through to develop, pitch, and distribute her product. She started 5 different businesses over her career. She's an author, and she now finds herself in the sustainable product development field. Lara, welcome to the show.
Thank you. It's great to be here.
Well, it's great to have you with us. So let's jump right in with where you find yourself today. Can you talk about your company? What was the genesis for it? How did it start? And where are you currently as a company?
Yeah, so my journey started in 2021 when I went through IVF.
Okay.
And I joined lots of online groups, and I kept seeing people posting up photos of their pregnancy tests.
Sure.
And it wasn't just 1 or 2, it was sometimes 5 or 10 or 15, and they were all plastic. And I just didn't realise women use that many tests. And I just thought, why is something that's used for literally 5 minutes plastic? It just seems crazy. So unfortunately, my IVF didn't work, but I couldn't get this image out of my head. And so looked into it and found that there was no non-plastic alternatives.
Sure.
So I thought someone needs to do something about this. And I thought, okay, that's going to be me.
Right.
I'll do something about it. And that's what started it all off.
Fantastic. So where are you today as a company?
So today we're working on a 100% plastic-free pregnancy test for the US market. So we're about to start clinical testing, then we'll do FDA submission to launch next year. So we have been selling a product in the UK, which has been really well received, but the US seems to be more open to sustainable options than the UK was.
That's very interesting, actually, to hear. So I imagine as you've gone down this journey, supply chain is something that certainly must have come into play. What are some of the challenges and roadblocks you face with your product development, things like acquiring materials, maybe even inventing materials along the way that haven't existed, and then ultimately in finding an outlet for distribution for your finished product?
Yeah, I mean, there's loads of challenges. I have to say, I didn't realise when you start developing a diagnostic test what is involved and the cost of what's involved.
Right.
In terms of the materials, we're lucky in that everything we're using is being used in other products,
Okay.
medical devices or medical materials. So that's quite straightforward. But what's more complicated is a diagnostic test looks really simple, but it's actually lots and lots of layers of different things, and they have to all be working together to get the right result, which is your positive or your negative. So our challenges have been, we've got the product developed, that wasn't too bad, but the challenge is now coming to clinical testing. We have to get 1,300 women to basically wee on a test for the FDA, and they have to be American,
Okay.
to do our submission. And so that's very expensive and time consuming. And then the other challenge has been around manufacturing. I want to manufacture in the US, but there's not actually that many manufacturers of diagnostic tests in the US. And the ones I have found, some of them have been like, well, we can do the first bit, but then we'll send it like to the other end of the country,
Right.
and they'll do another bit, then they'll send it back to us to finish it. And I'm like, well, I'm trying to reduce carbon emissions in transport, so I don't want it to go around the US 3 times before it's finished. So it's been tricky to find someone that can do everything in one spot.
Okay.
But I think we've identified 2 places now. So, but yeah, the US is a big country.
It is. It is for sure. And so once you have this finished product, how do you get it out to the masses, and what does that process look like?
I'm talking to lots of hospitals and clinics, and also Planned Parenthood and those kind of places. Everyone has been really excited about the product because it's basically used the same as current products. It's the same accuracy, same sensitivity. So all people have to do is just literally swap. There's nothing different in how you use it. And everyone has said if the price is the same, then yes, I'd love to have it. So we'll be selling it to hospitals and clinics, but also through private label to retailers such as CVS.
Okay.
So that consumers can use it in their homes as well as hospitals using it in a clinical setting.
Excellent. So you're certainly an entrepreneur. You've started several businesses. What have those prior ventures taught you about this business, and how have they helped inform this latest venture?
So many learnings. It's all the stuff ups that you make along the way that kind of help you. I think one of the biggest things, I was thinking about this last night, is about building relationships with people.
Sure.
Of my previous businesses, 4 of them have been manufacturing. I haven't manufactured, I've used a contract manufacturer, which is what I'll be doing here. And building those relationships with manufacturers is so important because that's what enables you to get the product when you need it, to get the right quality, the right quantity, and people will do more for you if you have better relationships with them. It sounds quite mercenary saying it like that, but we all know in business, people do business with people they like and they trust.
Sure.
And so that's a really important thing I'm bringing into this business. I also think for me, a really important part is trusting my gut. So I used to be very focused on doing what I felt was right. And then I worked for a large corporate. They were all about the analytics, and it had to be the numbers. And if the numbers didn't show X, you couldn't do it.
Right.
And I've realized that both of those routes are actually not right for me. For me, I need to combine the two, the numbers and the gut feelings. And when you think, oh, I'm not sure about this, I'm not sure about this person, you need to listen to that. And I think that's a really important thing for going forward.
Relationships and maybe a bit of a leap of faith in all of this too, right?
Yeah, definitely. Yeah.
So if we think broadly about plastics are basically oil and chemicals mixed together in certain proportions to achieve what we all use today. They're single use. They contain chemicals and different admixtures to modify them to meet certain design criteria, but oftentimes those aren't the best for humans. And so in healthcare, we use a significant amount of plastic. As you look at potential other opportunities within the universe of plastic in healthcare, do you find other opportunity?
I think there's so many opportunities out there. I think it's just a case of having an open mind. I mean, there's products coming up in terms of like plant-based with seaweed and algae and onion skins and all of these things that you wouldn't realize that it is made from that material because it looks like plastic, it operates like plastic. And I think it's just a case of as a manufacturer or a designer being open to those opportunities. And the thing is that it's not as easy as doing what you've always done. And that's the bit that people need to get over. It's not as easy, but it's better longer term. And there's so many implications to our health. And it seems crazy that as a medical company, that companies are using a product that harms people's health when they're supposed to be helping them.
Right.
And I think it's really about looking at each product and saying, okay, well, what else can we use for that? And doing the research and making the effort to actually make the change. But I think we can ultimately replace most of them.
I think you're right. Tremendous opportunity here. So what advice would you give other entrepreneurs who are blending sustainability and product development specifically targeted at the healthcare field?
Well, I think one thing I found in healthcare is it's quite siloed in that everyone is in their own little piece of the business and they don't necessarily talk to each other.
Right.
And that's been one of the challenges I've had in building this business is it's been very hard to find someone that has done the whole process of thinking of a product, taking it to FDA approval. So I would say that finding people who believe in your mission and can support you on that is like really important. And it might mean that you can't find one person, but you actually have to go to, say, 5 different people to get the whole parts of the chain of your process covered. But I also think that it's about challenging the status quo. And just because it's always been done like that doesn't mean it always needs to be done like that. And yes, that is harder. And yes, that will potentially take longer. But that is, I think, the big challenge in healthcare, that everyone's used to being like, we need more of those. Let's just press the button and get more.
Right.
Well, we don't need to do it that way. And it will be more time consuming up front, but ultimately it gives us a better outcome.
Change is hard, but it's certainly worth the effort in
Exactly.
this case in particular.
Definitely.
So that's great advice. I'm curious to hear more. You mentioned earlier something about marketing in the UK being perhaps a little more difficult than the US, and I'm certainly surprised by that. You've got really a global perspective based on your experience. Can you tell us a little bit more about what it's like to market in various different global markets compared to the US?
Yeah, so we were selling in the UK, and one thing I found that was really interesting there is lots of the big companies, and talking like retailers and the NHS, which is obviously the UK's big hospital system, they all have mandates on high that we need to reduce emissions, reduce plastics, these kind of things. And yes, at the top, very top level, they're doing some of that, but they aren't doing it at the level where me as a supplier is talking to the buyers. So I was talking to the buyers for Boots, which are one of the biggest pharmacy chains in the UK. And one of their things is to reduce Scope 3 emissions,
Sure.
which comes from the products that you sell in the store. Majority of them do. And so our product would massively reduce those. But that wasn't a factor in their decision making at all. They didn't. I actually said to the lady, what about Scope 3 emissions? And she said, what are they? So it feels like in the UK, and that's just one instant, but a lot of other retailers I spoke to had the same perception. They're doing things like putting solar panels on the stores or getting electric vehicles, but they're not looking at the easy wins, which is potentially the products in the stores. And I feel like in the US, everyone I've spoken to has just gone, well, yeah, it's a no-brainer. Why wouldn't I swap?
Sure.
And there hasn't been any of this, it doesn't fit with what we're doing, or it doesn't make us enough money, or it just seems to be much more open to give things a go here.
So does it feel like where we don't have the mandates, perhaps, that many areas in Europe do in terms of emission reductions, the support is a little more organic in the U.S. in that it's an individual person doing it because it's the right thing to do versus we're being told to do it?
I think so. I think definitely in speaking to people who are in charge of sustainability for hospital systems, they personally care.
Sure.
Whereas a buyer who's been told that we're doing this thing, they don't really care necessarily. But I've also found that it's been interesting. I was dealing with some companies in Europe, and we had a 99% plastic-free pregnancy test, and they said they wouldn't take it because they wanted 100% plastic-free. Mm-hmm. And I said, but this is like 90% better than anything that's sold.
Right.
Oh no, but you need to get rid of all the plastic and then we'll take it. And I'm like, but surely we can do it in steps. No, we can't do it in steps. It's got to be all the way. And I was just like, it seems so close-minded, like nothing, you've got to take these incremental steps to get to the end result. And in that time you're waiting for approval and the product to be developed and everything, that's another couple of years. That's another couple of million tons of plastic. Why not start now?
Don't let the perfect be the enemy of the good.
Exactly.
Sure.
And sometimes it amazes me how short-sighted people are, and I just think there's a lot we can do, and it's just finding the right champions that are willing to go there and make that change and make that effort.
Sure. That's very interesting perspective. Before we wrap up, any final thoughts?
One thing that has really been bugging me lately is greenwashing, which you guys probably know all about.
Right.
There's a lot of companies recently putting flowers on their website. Well, not just flowers, but plants and stuff.
Sure.
And so you instantly think as a consumer, oh, look, they've got something sustainable. But they haven't.
Right.
And I think that's one thing that makes it very hard for companies that are trying to do the right thing. There's a lot of companies trying to make it look like they're doing the right thing. And that makes it's very hard for consumers to tell the difference. Not just consumers, but retail buyers and hospital buyers and everything. And so I think one thing I'd say is just read the fine print and try and find out more about products before you buy them. Don't just trust that just because the packet is green, it's one example of greenwashing, that it actually is more sustainable. So yeah.
Nope, great advice. Lara, thank you so much for joining us today. We definitely appreciate your insights.
No problem. Thank you for having me.
And thank you to our listeners. Until next time, I'm Tim Doak, asking you to think sustainably.
Thank you for listening. You can find more episodes on our website at northernlighthealth.org/healthy-happy-wise and on YouTube, Apple, and Spotify, making it easier for you to listen on the go on your favorite app.